If you've ever felt that you're doing everything right for your skin, but you're not seeing results in the way that you'd expect, there's probably a missing layer to the understanding underneath. Healthy Skin 101 is all about stepping back from the products and the trends and getting clear about how your skin functions in the first place. I'm Dr. Kenny, a dual doctorate and IFM certified functional medicine practitioner, and I'm all about helping you better understand how your body functions with root cause perspectives. When you understand the fundamentals of how your body or your skin functions, a lot of the confusing and conflicting advice out there suddenly starts to make sense or melt away if it's useless. So before we talk about any ingredients or routines or even treatments, we need to look at the systems that your skin relies on to stay balanced and well functioning. And it starts with a major reframe that many people don't consider when talking about their skin. Remember, your skin is the largest organ of your body. It is living, it is breathing, it is constantly responding and showing you through those responses what is going on in the inside and outside of your body. And that's nothing to scoff at. Your skin isn't just sitting there waiting for the next best product. It is there responding to everything: your sleep signals, your environmental stressors and exposures, to hormones, to nutrition, to internal shifts that we can't even symptomatically perceive. Once you start looking at your skin this way, the question that you may be asking begins to shift in a profound way. Instead of asking, what can I put on my skin to fix this? You may start asking, what is my skin responding to? Or what is it trying to tell me? And that shift matters. I see patients coming in, putting in all the effort when it comes to trying the latest and greatest products, but their results don't seem to match their depth of efforts. And usually that's because the skin is not the starting point. It's actually the end point and the output of the information the body is experiencing. You can almost think of it as a check engine light, just on the entire surface of your body. It's not the whole problem. It's usually a manifestation of what's going on underneath the hood. So where do we begin here in this systems conversation? Let's start with one of the most important systems first, and that is around energy and blood sugar regulation. Since your skin is constantly responding to internal signals, one of the systems that matters the most is your metabolic system. Because your skin is a living organ, just like every other tissue in the body, it depends on steady energy for repair, renewal, and maintenance. One of the biggest disruptors of that process, body-wide, is blood sugar instability. And I'm not talking about the end-stage experiences of these like prediabetes and diabetes. I'm talking about the repeated spikes and crashes or the blood sugar roller coaster that most Americans are on. Up to 93% of Americans are considered metabolically unhealthy, and blood sugar is at its core. Over time, that creates wear and tear on the system. And one of the processes in which this occurs is called glycation. Glycation occurs when sugar binds with proteins in the body. In the skin, two of the most important proteins here are your elastin and collagen. Collagen gives your skin structure, like the scaffolding, while elastin keeps it flexible. When those proteins are damaged through the process of glycation, your skin may noticeably change, quite visibly. You may see sagging skin or dulling of the color, or even wrinkles. And this is not just theory. The research shows this as well. A 2024 systematic review and meta-analysis found that these glycation-related compounds can build up from both metabolic challenges as well as dietary inputs and can visibly affect and manifest on the skin. In other words, the way that your skin handles blood sugar balance can quietly be affecting the way that your skin ages and functions over time. This is one reason why people can be doing all the right things topically for their skin and yet not see the results that they're expecting. So obviously metabolism is not the full story, but it is one of the main systems where we begin. But there is one big factor that affects virtually every system we're going to be talking about in this discussion, and that is inflammation. Inflammation is part of a normal and healthy immune system. In the short term, it helps to repair tissues and recognize danger threats. But when it does stay elevated for longer periods of time, it changes how your tissues function. Your skin is especially sensitive to that shift in function. Because your skin is constantly repairing itself and turning itself over, the environment that it's living in matters dramatically. If that environment is consistently inflammatory, the repair and renewal process becomes a lot less efficient. This is where you start to see changes like increased redness or tone issues in general, as well as skin sensitivity or shifts in the texture. Additionally, many formal dermatological conditions, from acne to rosacea, have a foundation in inflammation as well. What makes this factor perhaps the most complex, but also ties it all together, is the fact that inflammation is often not coming from one single source. Inflammation is combined across the body, including what we put into our mouths, the inflammation that occurs when we are highly stressed, as well as hormone signaling, blood sugar imbalance, or environmental exposures. All different inputs, but similar outcomes in the inflammation world. This conversation has sparked a new term in the research known as inflammaging, or inflammation and aging. A 2023 review describes how chronic low-grade inflammation affects the skin repair process, as well as increasing oxidative stress. When we talk about oxidative stress, just think of the browning of an apple. That same thing happens to our tissues, but we have antioxidant mechanisms to combat oxidative stress. Practically, what this means is that your skin doesn't just age in a time-dependent linear fashion. It's also affected by the inflammatory signals that are occurring throughout the body. Once we start to understand the importance of the environment when it comes to skin health, the next question becomes, what part of the environment is likely shaping your skin health most consistently? One of the biggest influences comes down to hormone signaling and processing. If inflammation is one of the main environmental drivers, your hormonal systems are the way that those signals are communicated between systems. Most people focus on the end stage hormone levels when it comes to hormones and skin health. Too much estrogen, too much testosterone, not enough progesterone, too much cortisol even. But functionally speaking, that's only one part of the picture, because your body's not just producing hormones, it's constantly transporting them, breaking them down, and clearing them from your system. And in my clinical experience, this is a huge area that is underappreciated when it comes to hormone health. Estrogen, for example, supports the hydration and elasticity and vitality of the skin. But even if your estrogen is in a quote-unquote normal range, the way your body's breaking down and detoxifying estrogen is equally important. Because if you have roadblocks in your clearance of estrogen, this can also cause roadblocks further up in the inflammatory pathways and beyond. The same applies to androgens like testosterone. Testosterone and other androgens help to regulate, for example, oil production when it comes to the skin. And so roadblocks not only in just the final number of testosterone or DHEA matter, but also the way your body is processing those and breaking them down. This creates a pattern that can be confusing for some because we're often not screening for other detoxification markers associated with hormones. The big summary here is that externally and on most conventional labs, everything may look normal or that it's running smoothly. But underneath the surface, we may see roadblocks and mismatches between hormone production and hormone clearance. And you guessed it, this is where your skin responds to that mismatch. One of my favorite tests to approach questions like this is something like the Dutch test that looks at not only your levels of your hormones, but the levels of the metabolites or the breakdown products of those hormones as well. It's like looking for little footprints in the clues of a dried urine sample. This may not be necessary in every case, but it can help to speed up the process and drive clarity rather than guessing what may be going on in your hormones underneath. The most useful question that the Dutch test, for instance, answers isn't if the hormones are present, but rather how are they moving through your systems? And when we start to look at these hormone systems, another pattern emerges that becomes very difficult to ignore. And that's because one of the biggest regulators of both inflammation skin and hormone health is the gut. When people think about the skin, they rarely think about gut health. It's changing slowly but surely. But the gut represents a main immune system interface throughout the entire body. Along the lining of your gut, your immune system is constantly interacting with your gut microbiome, or the species and ecosystem of microbes that is living inside of your digestive tract. And they're in constant communication with one another. Ultimately, these interactions add up to determine how reactive or not your immune system is across all your body systems. When your gut environment is stable and your gut lining and barrier intact or well supported, the immune system generally stays in a calmer, less reactive state. But when it's disrupted from stress or dietary factors or other environmental influences, it can become more reactive. And that shift often shows up beyond the gut. The skin is one of the main areas that it does show. This is where chronic acne or rosacea or reactivity or slow healing of the skin also takes place. And there's a growing body of research that describes this gut-skin axis, and it implicates the role of the gut. And it shows that changes in your gut health function can influence the immune system, as well as oxidative stress and inflammatory signaling throughout the rest of the body. In practical terms, your skin is influenced by how your immune system is behaving, and your gut influences your immune system behavior. And this is where tools like advanced microbiome testing can come in. We can get a snapshot of what your microbiome looks like, but also inflammatory signaling and barrier integrity of the gut as well. What surprises many people is you don't need to be having stark digestive symptoms to display some kind of imbalances in the gut and the microbiome. So when we tie these systems together, we can start to approach skin health in a more structured and organized way. Metabolism influences blood sugar. Blood sugar influences inflammation. Inflammation interacts with hormone signaling throughout the body. Your hormones depend on detox pathways, and of course, the gut is overseeing many of these processes and becomes central. These systems are overlapping and isolated. You can't make changes in one without affecting the other, like an intricate spider web. And that is why acne can be so complex for individuals, because their combination of systems involvement may be dramatically different from somebody with almost the exact same symptoms. This also explains why focusing on a single piece of the systems puzzle often gives less than desired results. Or some people may see initial improvements, but then go back to baseline or take a step back. And that's a common situation I see with patients. That cycle and that expression of change in the skin isn't random. It's feedback from this systems-based lens. And it often means that a piece of the pie wasn't considered. So I'm curious, once you start to think about the skin as this living, breathing organ and as a manifestation of these systems underneath, does it change your perspective a bit? The goal may no longer be about finding the perfect product, but rather, how do I tune in to my system's signals underneath that are manifesting on my skin? Products still have a role. They can support the barrier, they can decrease inflammation topically, but they are often tools to be leveraged, maybe not the entire solution. So perhaps one of the best next steps is to ask yourself what systems may be influencing your skin conditions. And remember, it's often not just one. We talked some about the gut's role in regulating immune activity and inflammation. What actually causes the gut barrier to break down in the first place? Barrier integrity is central to the skin, and this video we go over that exact topic, so check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.